We are getting ready to talk about one of my favorite subjects. Did you know that NCLEX is changing? It absolutely is. And I want you to be ready for it. You got to be ready now to take the current NCLEX, or you're going to have to learn about all these changes. Either way, I got time for it. What is going to be different about the next generation NCLEX? Well, there are many things. This is part 3 of me going over what is going to be different. But today I'm going to specifically focus on the new question formats that are coming. So, and this is the thing. If you are taking next generation NCLEX, you can see literally all of the new questions throughout your exam. And also, as a reminder, you may want to know that the current NCLEX items will still be present on the exam as well. We are talking about a marriage between the current NCLEX and next generation. So what do I mean by the items? For example, there's going to be an enhanced hotspot. So we looked at highlighting that can be done in the context of a paragraph or a table, meaning, what do you identify as irregular, abnormal about this scenario, this situation? Another item could be, the extended multiple response. And this is very significant because usually with select all that apply, we are thinking, okay, there's going to be 5 item options and no more. But with this extended multiple response, we are going to be seeing 10 choices, right? Up to 10 choices. And you are going to have to select everyone that applies, or a specific number that applies. So maybe they say select 6 of the important findings, or select 2 of the important findings, or select 9 of the important findings. I don't know, but they'll give you the number. And then also grouping items to dictate whether they are correct or incorrect. So these are new. We also have the extended drag and drop formations. And we can see these in the cloze style question formation, or in a rationale format where X equals Y, right? So diabetes mellitus equals hyperglycemia, polyuria, a drag and drop in that formation, or we can see it in a table presentation, which we have not seen yet. I love the next one. This is called a bow tie question. And with the bow tie questions, you're going to be looking at the 6 steps in the clinical judgment measurement model that are going to be actionable for a nursing student. Constructed responses are also going to be seen because you're going to be giving the appropriate reaction for the action that is presented to you. And of course, the matrix grid, where you have radial style buttons and multiple responses, and or just a basic multiple choice in this presentation. So lots of new question types that you should be expected to be able to clear. Your nursing school right now should be presenting these to you, explaining them to you. I'm excited to see curriculum changes, to see increased critical thinking and more collaboration among educators, because these are all going to be very real. All of these are going to be very real items for the NCLEX exam. So introducing next generation, I love to give you a sample question type so that you can see. So here is our first presentation, and this is the question, okay? And this could be presented in a case study form or really just a regular standalone question. But let's read it together. So there's a time marker here. Time is going to be very prevalent on the next generation NCLEX because you might be looking for changes in your patient throughout a certain time reference. So at 10:15, what do we have? JD, a 26-year-old male, presents to the emergency department in a wheelchair with abdominal guarding. He reports a sudden onset of right lower quadrant abdominal pain accompanied by nausea and vomiting a few hours ago at work. He could not find a comfortable position as he was asked to lie down in the observation area. The pain worsens each time I move, he verbalized. At 11 o'clock, the nurse assesses the client and notes the following: blood pressure 110/80, pulse rate 98 beats per minute, respiration 19, temperature 38.3 degrees Celsius, pain scale 8 out of 10, negative bowel sounds plus positive abdominal distension. So the question is, number one, which top findings need further investigation? Select all that apply. Is it number one, right lower quadrant abdominal pain? 2, discomfort. 3, pain scale. 4, pain worsening with activity. 5, nausea and vomiting. 6, difficulty in ambulation. 7, vital signs. So we're looking for the top findings. We're looking for the top findings that need further investigation. All right. And remember, this is an extended multiple response question. And so with this, there's also partial scoring. So let's see if you got it right. The correct answers are as follows: number 1, number 3, number 5, and number 7. All right. So why is that correct? Number 1, we are thinking right lower quadrant abdominal pain is definitely an abnormal assessment. And so the thing about next generation NCLEX is that you're going to have these keywords like top or most, right? And so that means that the others are very real, but are they the most relevant? So we are going to pick the pain scale to be addressed because discomfort is a very general term that is not going to be explored, right? So of course, if a patient has right lower abdominal pain, that is going to be more appropriate as a need for further investigation than general discomfort, right? The pain scale is irregular, right? The pain scale for this patient is irregular. The pain worsening with activity, what do we call that? That is a byproduct of the right lower quadrant abdominal pain. So we need to address the right lower quadrant abdominal pain, right? That is going to be the main source of the issue. Pain worsening with activity, well, that just it makes sense that would be a part of the issue, but it's not considered a top finding. Nausea and vomiting. Nausea and vomiting is very relevant because if there is left quadrant abdominal pain, as well as nausea and vomiting, that is going to be a correlation that something further may be happening with your patient. And you guys, as I continue on this train of thought, you all should be thinking of a diagnosis right now. Right now, based off of what you've been presented, you have enough to know what may be going on with this patient, right? Difficulty with ambulation, that's not something that was really brought out except for the fact that he was in a wheelchair with abdominal guarding, but that's just the same kind of like as discomfort. So yes, right lower quadrant abdominal pain, you are going to have difficulty with walking, but it's not going to be the ambulation that needs to be explored more so than the pain, right? And so vital signs also, we're going to want to know more about this patient because remember, pain is considered part of your typical vital signs. You need to address that, right? We also need to know more about the patient. Are there going to be more issues with the blood pressure? Is that the normal blood pressure for this patient? The respirations, we're going to want to watch them. We're going to want to monitor them more, right? And so we're going to include the vital signs as part of our further investigation for this new patient. And remember, guys, with case studies or questions that could be in the format of a case study, you're going to be following this patient over a certain period of time. So it would behoove you to gather as much assessment information about this patient as possible, especially on the very first question. And I'd love to talk to you a little bit more about that in our next video. Let's go on and do another question here. What possible, thinking about the patient that we saw here, what possible conditions could the client be having? And this presentation is going to be a multiple matrix. All right. So you're going to have columns here and you are going to have to click. It says click to the client findings that are consistent with a given set of diagnosis. So each finding may support more than one diagnosis. So this is very important in analyzing the cues. Based off of what we've been given about this patient, it could be a urinary tract infection, pancreatitis, or appendicitis. These are the three differential diagnoses that could possibly come into play with this patient. So now what we're going to do is we're going to look at the symptoms and we're going to say, is this a urinary tract infection? Is this pancreatitis? And is this appendicitis? So you have to be ready and willing to do those things. All right. This is where I'm telling you guys, you have to know the content. Get into and that's why we're doing the quick facts is going to be a great place for you to start. And then the virtual trainer is going to help you to review this information and in a very real way, be prepared to be fully examined about what you know. So fever, do you see that in urinary tract infection? Do you see that in pancreatitis? Or do you see that in appendicitis? And if fever applies to all three, the intentions for NCLEX is that you are going to check the box in all three. If it doesn't, then you would only check the box in what it would apply to. Nausea and vomiting. Are you going to see that in a urinary tract infection? Are you going to see that in pancreatitis? Are you going to see that in appendicitis? And so this is what you have to do. And remember, this is a partial scoring as well. So the choices that you get correct, you'll get credit for. And then the choices that may hinder you if you don't get them correct on the next generation, they can actually take points away from you. So if we were just doing this, yes, you're going to have fever in all three of them. What about nausea and vomiting? Right? Do you see that in the urinary tract infection, pancreatitis, or appendicitis? Okay. You can see that in all three of them. All right. So this is what you're going to have to be ready to do. All right. The right lower quadrant abdominal pain, that is going to be a marker specifically for appendicitis. Did you know that? What about abdominal distension? Where would you expect to see that at? Okay. So as you are reading these questions, you have about 2 minutes to determine what the correct answer is. Abdominal distension, pancreatitis, appendicitis, absent bowel sounds, pancreatitis, and appendicitis. So if you're just studying pancreatitis, you better know the difference between appendicitis now, between the two of them, and a urinary tract infection or anything else that they could have put here. All right. This is a question that is a very good question in determining what a student knows and what they don't know. And it's just little fine differences. All right. So are you ready for this next generation NCLEX? If your school did not prepare you for this and you can take NCLEX now, you need to be doing all you can to take your NCLEX exam right now. Okay. I cannot stress this enough. This third presentation is an example of a a drop-down cloze formation. So this is how I chose to present it to you guys. So we're talking about JD here. JD is most likely experiencing, and so this is a fill in the blank, basically. What would you say based off of his symptoms? Is he experiencing a UTI, pancreatitis, or appendicitis? What do you guys think? Okay. And then, so this is a choice with 3 options that you have to get correct. So this is the XYZ choice, right? The emergency room nurse must prioritize which of the following? What would you choose? Preparing the client for surgery, giving antiemetics, or measuring intake and output. What is going to be the best answer for this slot here? And then to prevent the highest risk of, what are we worried about? All right, what are we worried about? Abdominal distension, fluid and electrolyte imbalance, or ruptured appendicitis. What are we going to be worried about? And the correct choices here is, you would have to pick these. And again, this could be a drag and drop, or it could be a drop down click. It depends on how they want to present it to you. But JD is most likely experiencing appendicitis. The emergency room nurse must prioritize preparing the client for surgery to prevent the highest risk of ruptured appendicitis. Okay. All right, guys. So this is another look at how NCLEX is changing. Are you prepared for it? Are you prepared for this exam? If you are not and you want to take it, get ready. Okay. Here is another grouping. This is actually a grouping response. And so let's read what the question says. For each area of nursing responsibility, identify which nursing actions are contraindicated in JD's case. Each area may have more than one contraindicated nursing action. So I literally, when I wrote this question, I have actually many segments more than this, but I'm just presenting you these 2. So assessment, which one would you check? Monitor vital signs and pain scale. Assess pain, severity, and location by palpating all quadrants of the abdomen. Ask about the onset of present illness. Check client hypersensitivity to medications. Okay, so do you have your answers there? Which one are you going to check? And then what about the pain or discomfort management? Administering analgesics round the clock until the client is pain-free. Encouraging deep breathing exercises as tolerated. Encourage warm compress heating pads on the affected site for natural pain relief. Or assist client into a semi-Fowler's position as tolerated. What say if you guys? And remember here, there's many more responsibilities that we could have gotten into: nutrition, activity, all kind of things. But for these 2 that I selected, for assessment, the only thing we would be not doing is contraindicated is assessing pain, severity, and location by palpation. You don't want to do that, and you need to be able to notify that is incorrect. And then also for pain and discomfort, we are not going to administer round the clock until the client is pain-free. We should be doing the pain management as the client requests, okay? And then also encouraging warm compress. We do not want to do a warm compress for appendicitis. And if you don't know why, I definitely want you to look it up. All right. If you have the potential to take and pass NCLEX now, let's do it. But if not, we will continue to prepare for next generation NCLEX. However, I am doing my due diligence. I am encouraging you as your NCLEX instructor. Right now is the best time and opportunity to take the NCLEX exam and get your nursing license. There is not a better time coming. I'm telling you guys, do not waste an opportunity to test now. All right. So if you're able to test now this year, do it. And then let me show you how to do it. Let me show you how to do it and passing your board in the next 4 to 6 weeks or less with my NCLEX virtual trainer straight for you. So if you are ready to get your nursing license, this is the opportunity. You can, you will, you must pass NCLEX, because with God, it's possible. All right.